And go. Hi, I'm Dr. Trish Winter, the director of the music therapy program at Radford University, and I'm here with my colleague.
I am Corey Cassidy, and I am a professor in the Department of Communication Sciences and Disorders at Radford University.
And we're going to talk about a collaborative and interprofessional music therapy and speech language pathology program that we have been working together on for the past 7 years. So the Preschool Language Lab program has been ongoing at Radford University for a number of years, and it was started by Dr. Cassidy. If you would like to just give a background of the pre-music therapy time.
Sure, absolutely. So I joined the faculty at Radford University in 2007, and we started the Preschool Language Lab in the summer, the following summer, 2008. So we've been running this program for more than 12 years. As Trish has got up on the screen here, it's changed quite a bit over the years. It started as a 6-week program, and it's moved into more of a 4-week intensive clinic for children, anywhere from 18 months to 6 years who have speech language communication disorders. And we set it up so the kids come twice a week, either Monday, Wednesday, or Tuesday, Thursday, traditionally. And they come for about 2.5 hours. We set it up just like a preschool, hence the Preschool Language Lab name. And so for the first 5 years or so, we had speech language pathology graduate students running the program. We have 6 children in a group with 3 clinicians, so a 1-to-2 ratio. And then we also recruit undergraduate students to support those students, whether that means running a child to the restroom or changing a diaper or grabbing some paper towels. They are there to assist, but by the end of the program, they're really enmeshed in providing services as well. They learn a lot because they're right there in the fray of things. So about 7.5, 8 years ago, Dr. Winter came on board and said, hey, this sounds like something we could work with. So I'm going to hand it back over to her to talk about how we pulled together the 2 professions to really make a difference.
Yeah, so I contacted Dr. Cassidy and I said, what do you think about adding some music therapy with a very consensus model of clinical work whereby music therapy students would come in and they would provide a music therapy time and that there would be speech language pathology time happening. But when we got together and discussed the program in more detail, it was evident that a better option would be to fully integrate music therapy and speech language pathology and not to have them as separate entities. So for the first year, we were really finding our way, and there was definitely a much more of a separation between what music therapy was and speech language pathology. But after that first year, when both Corey and I understood who we were and what we were doing, that began to shift exponentially. And the music therapy time, the speech language therapy time began to really gel into our time together with the children with less of a delineation between who was doing music and who was doing speech and who was responsible for what. It became the responsibility of everyone to do everything. So there is one music therapy student in the clinic for each clinic session that we have. So we have up to 2 music therapy students each summer, and they work alongside with the speech language pathology students. So they take children to the bathroom and they help with snack time and craft time. And the expectation is that everyone's really immersed in the ongoing and day-to-day activities of everything that happens in the clinic. We've also done some caregiver training. We had a really well-designed research arm where we specifically spotlighted the caregivers and gave them some training, and we'll talk about that a little bit later. So here's what the PLL looks like, kind of. It's how we start. So Corey, if you want to talk about how you help students come up with a plan, and then we can talk about what happens to the plan in 4 weeks' time.
Absolutely. So, initially the students come in and they only have about a week or 2 to train, to prepare, to plan, to create a team among themselves. Many of them don't know each other coming into it, especially between the speech pathology and the music therapy students. And so I, early on in this process, created, and it's always a work in progress from summer to summer as well, but created an outline of the expectations for the summer session. And so as you can see, again, this looks a little bit like a preschool classroom would. We make sure we have lots of free and choice play, circle time, story time. Every week, the students have a new theme, so they have to determine a theme, and then based on that theme, they come up with songs, they come up with a book, and most of the things focus on that book, the characters in the book, the content of the book. The free and choice play we call it free play with the kids, but it really is a choice. So the students will also come up with themed activities where the children can choose. So maybe they're playing with, if the theme is at farm animals, maybe they're playing, they have the choice to go play on the floor with a farm set, or they can go play with Play-Doh with farm animal cutouts on the table. And so depending on how we want to sort of coordinate the children into small groups to work on some of their skills and their development, or what they might need in regard to sensory needs. And then of course you can see music is embedded, and that changed when the music therapy students joined us. We added music and movement, which does often carry over from the music as well. And so we added those. As the students get to know each other, as they get to know the children in particular over the course of even that first week, it's amazing how much this schedule will morph. So they'll find that, you know, you have 2 or 3 of the 6 kids who start talking about food 20 minutes into the session. And so maybe they move up snack. And I will say even the snack has a theme. So they will create ants on a log, or some kind of fish scene on a cracker. They try to make things integrated into the theme, but also collaborative among the group. And they're always thinking about, even when they're in the bathroom washing hands, how do we include their goals and their objectives that we'll be talking about in a minute. So by the end of the summer, this often looks quite different, but by setting up this template for them, it takes a little bit of the pressure off of where to start. And so it allows them to evolve as a team, evolve as a group with those specific children, because they're different every summer, but to have a starting point from which to jump.
And while there are set aside music times where the music therapy student is sitting down and engaging children in playing instruments and singing and moving, that doesn't mean that's the only time that music's happening. And ideally, music should be happening all the time. It should be happening for transitions. It should absolutely be happening in the bathroom, because the acoustics are so good in that room that we need to be singing in the bathroom. And over the years, the music therapy students have gotten really creative in writing a bathroom song and a marching song and a transition song. And those songs actually end up with a life of their own and get carried from one music therapy student to the next music therapy student from summer to summer to summer, which has been a really awesome outcome of the entire experience, especially for the music therapy students.
And Trish, if I can just add too, you could stay on either screen, but if I could just add that, you know, they are required to either come up with or carry over a hello song and a goodbye song, the same every session, so that the children can really jump in and join in on that. But they also typically in the circle time in the morning create a name song, or the hello song is the name song. And so part of that is, you know, you have 6 children coming in together who typically don't know each other either, who are different age ranges, different needs, developmental needs, speech and language needs, and even musical levels, right? And so that song where they incorporate their names, the children's names and the clinicians' names, also makes a big difference and sets the stage for those interactions and those opportunities for the kids.
And what's nice about that is that the expectation is that the speech language pathology students are supposed to be singing, whether they feel like they are singers or not, and that the music therapy students are supposed to be learning the really wonderful speech language pathology modeling techniques, not that we would do them as trained speech language pathologists, but that they're really good practice. So they're both sets of students are really learning from best practices from both of the disciplines. All right, so that's a nice transition, actually. We respect that each discipline has a unique place in the clinic. We do not want to water down music therapy or speech language pathology, and we also want to make it incredibly clear that SLPs and MTBCs don't do the same thing, and that scope of practice is there for a reason. So we honor the unique place of each discipline in the clinic, and we'll break down both sets of goals in the next 2 slides. All right, so music therapy goals, I'm going to start from the bottom and work up, sort of like Maslow's hierarchy, but realizing that the foundation of everything we do in music therapy in the clinic is about building musical relationships through the active engagement of making music. We immerse the children in music, and music happens all the time, and we think about different ways that music can help children settle down if they're distressed, attend to task, and then engage in things like creativity, spontaneity, interacting with their peers. Many of the students come into the clinic and they struggle with interacting with age typically aged peers, and they tend to interact more with the adults in the room. And the focus is to get them to interact with peers so that they can get ready for preschool and kindergarten. We also focus on leadership and absolutely supporting SLP goals in whatever way that we can, such as emphasizing specific sounds and songs or emphasizing specific words. And then play goals, helping children to develop in stages of play.
So as far as speech language pathology goals, I think you'll see some overlap for sure with the music therapy targets, but keeping in mind that we're coming at these or addressing these from a different perspective, and looking at, again, the children who are in this program do have diagnosed speech or language or communication disorders. Some of them have autism spectrum disorder, some have Down syndrome, some have cerebral palsy. We have kids with cochlear implants, and we also have children who are just a little bit delayed and might just have trouble targeting certain articulation sounds or embracing play and learning how to develop their play skills. And so again, you'll see some overlap, but if we look at some of the specific goals, we are looking at improving speech intelligibility. What are the speech sounds and the phonological errors that need to be addressed for individual children? Certainly receptive and expressive language skills. How do they understand and process information, and how do they use that information to communicate their needs and their wants? Certainly participating in interaction and engagement with peers. As Trish said, that's a huge component that we can help our students overlap, but also recognize the unique perspective they're bringing in from the two different disciplines. The children are also working on communicating with adults and peers through musical experiences. So one of the beautiful things that I found about this collaboration is that the music really opens up the children's not only opportunities, but opens up their willingness to communicate. And that might be through imitation, that might be through a response to a prompt. It might just be making noise. It might be taking turns with an instrument. It might be touching a guitar when somebody's holding it and actually getting up close enough to do that with an adult. For some of the kids, that's a significant goal that we're working toward. And then learning and embracing leadership roles. Again, Trish looked at that or talked about that a little bit. A lot of our children come in, and even our 4 and 5-year-olds, and they're the ones that the child care providers, the preschool teachers tell their parents, they're not, they kind of sit in the corner, they get in the end of the line. In this case, we're working with 6 kids and enough clinicians to really encourage and facilitate those leadership skills. So whether it's with music or getting in line for the bathroom or turning the lights on and off or starting the song to get everybody to listen, leadership becomes important because we know that all of our children are capable, but many of our children don't know how to embrace that opportunity. And then finally, again, as Trish said, that top of her hierarchy is engaging in developmentally appropriate types and levels of play. So moving children from one level to the other. Most of our children are delayed in their play skills because they don't have the communication to facilitate that. So again, lots of unique objectives and goals that we create for each of our children, unique among the children, but also unique between the disciplines, but such a great opportunity for our students to learn how we're different, but how we can come together to provide best practices. And I know we're going to talk about this in just a minute in our last 6 minutes that we have here, Trish, but we've also learned over the years that that is a significant component of this program in our own student outcomes, is that they really learn what music therapy can do, what speech language pathology can do, and how important each of the disciplines is to pulling together evidence-based best practices.
Absolutely. So again, we did talk about the collaborative goals, and there are places where there's overlap. So you can feel free to look at that slide. It's sort of a redundancy from what we just talked about. So co-planning in the clinic, the speech language pathology and music therapy students co-plan together and co-implement together. So they're sitting in a room, they're coming up with what's going to happen week by week, day by day. And then both groups of students are co-supervised simultaneously by SLPs and MTBCs, which has been really awesome. We do start the summer session with grand rounds about each child, and we have post-session feedback after each session, each day, in a fully collaborative environment. And over the years, we've gotten very comfortable hopping in and helping each other's students to do their best work. And the student interventionists also do get individual supervision within their disciplines as well.
A side opportunity, Tricia, if I can add, is that we are in a luxurious position, and we recognize that we have two-way mirrors for our clinic rooms where we provide these services on our campus. And so we have parents and caregivers back there with us, and they actually get to hear us discuss, well, who's doing that right, and who needs to work on that, and what kind of a skill is that, and how could we implement music into the speech and language, or speech and language into the music. And so the caregivers, the parents, actually learn from that. Whether we're targeting that or not, they take that away as well. And usually what we see is the conversation between the parents among them and with us is that they begin to recognize the power of music, and musicality invested and embedded in communication. And how integral the two can be. And so we often hear them come back week 2, week 3, week 4, talking about the things that they did at home within their routines and everyday activities, where they've added music to transition, or they've added music during bedtime routines, and what a difference that's made to get their child to initiate a request, or to respond to a question, or to even take a leadership role with their own siblings. And so that's been a really neat experience for us co-supervising, to be observed and to participate with the families as part of that process as well. Kind
I
of
think,
having a nice ripple effect beyond the students.
and what's also been really nice is that there's something very disarming about having the students in the clinic room taking these risks. The SLP students, some of them are singers, some of them have been in choirs, a lot of them are not. And the music therapy students are not by nature talkers. We don't do music therapy because we want to talk all the time. So both sets of students are really crossing over into areas which are not strengths for them. And when parents see students who identify as non-singers trying to sing, we believe that parents feel empowered to sing, and that it sort of breaks down that idea that I'm not a singer, or I can't sing, or I don't sing, because there's a lot of that risk taking that's happening in the clinic. And we've had that feedback from parents, and that's really been a super nice part of the clinical experience. Okay, so outcomes just this past year, to a music therapy student and a not music therapy student, a health and human sciences student at Radford, went through a lot of session video and sort of broke down what was happening, and watched the clients develop and change over the course of 4 weeks. And these are some of the observable increases that they found by watching session videos. That over the course of 4 weeks, there was an increase in initiating instrument play, an increase in exchanging instruments with peers, an increase in engagement from peer to peer, which is absolutely what we're both working on, increases in pitch accuracy while singing, increase in purposeful singing, increased attention during music, and increase in leadership skills even among the more reserved children.
Lots of good stuff happening in that session, in that program.
And really anecdotally, and in a very short way, we do also see these clients in the fall semester, although the collaboration is very, very different. It's a lot more consensus model, where the music therapy student works with the children and the SLP student observes, and vice versa. But the change between the start of the summer session and the start of the fall session for a few of the young children clients was remarkable. That time of being in the clinic, and that little bit of break that they had before they started into the fall clinic, allowed for really impressive development to happen in terms of interacting with others, speech language acquisition, increasing the number of words that a child will put together into a phrase length. I don't think I'd ever seen that before this year, and I was stunned by how successful the interventions were. And how quickly that development happened for a few of the children. So we have done a few research initiatives since 2012. We did a caregiver training and stress reduction study, and we found a significant reduction in caregiver stress with the participation in the training program. We did some research on student readiness for interprofessional practice, and that's referenced in the reference list at the end. We have an article published, and found that the interprofessional opportunities were really important for understanding one's own scope of practice, as well as the scopes of practice of other disciplines. And then we just recently conducted the review of session video, which we're going to continue to do as we develop an understanding of what interventions are most effective and maybe how to put interventions together to create more cohesion in what best practice means. So here's our reference list. Is there anything else to wrap up the session?
No, I mean, I think, we have a lot more to say, but in our 20 minutes, we're right down to the wire here. I think we've done the best we can, but we would love for people to reach out and contact us. You can find us on the Radford University website. And we just feel really strongly that this is an effective way to provide services, an effective way to teach our students, and a wonderful way for music therapists and speech language pathologists to collaborate professionally as well. So thank you all for your time and for listening.
Thank you and enjoy the rest of your conference.